Yes, definitely the family needs genetic counseling because mucopolysaccharidosis, especially type 1, is autosomal recessive in nature. So that means a child gets the disease gene from both the parents. And there is a 25% recurrence risk in every pregnancy. So ideally, the family needs to come to us before planning a pregnancy so that we can work up the affected child, whom we also call as the index child. So we will be doing an enzyme evaluation and a genetic testing to find out the exact genetic problem in that particular affected child. This can then be used to plan testing in the pregnancy. So it can be done anywhere between 11 to 13 weeks of pregnancy or after 16 weeks by a test called amniocentesis. When it is done at 11 to 13 weeks, we call it as chorionic villus sampling. So the particular mutation in the family will be specifically checked for in the CVS sample, and we can know if the fetus is affected or unaffected even by early pregnancy. So this disorder doesn't present by ultrasound, and it will present only after a few months of birth. So invasive fetal sampling by CVS or amnio would be the only way to identify the disorder. Genetic counseling is also very important so that other family members, so there could be brothers and sisters of this particular parent who might want to get married. So we can also ask them to get screened for this disorder so that we can prevent this happening further in the family and at the population in at large. So another option that these families can opt for is IVF, in vitro fertilization, with pre-implantation genetic testing. So here in the embryo, this particular genetic problem is looked for, and only the embryos that are good are actually put back into the uterus so that that future diseases can be prevented, especially for MPS type 1. And again, this is confirmed by CVS or amnio later in pregnancy. So there are definitely ways we can prevent this disorder from happening once we know the index child's mutation.